Well, it's been a full week now since South Africa moved to alert level 1 of the lockdown regulations. There have been fears that the move could see infections rise and spark a second wave as citizens relax their vigilance against Covid-19. This, of course, comes at a time when there is a reported new surge of infections in the United Kingdom and other countries. But for more on what the story behind South Africa's Covid-19 numbers is, I'm joined via Skype by the head of Department of Internal Medicine at the University of KwaZulu-Natal, Professor Bulie Magula. Professor Magula, a very good evening to you. Thank you so much for joining us. Welcome to The Globe.
Good evening, Cynthia, and good evening to the viewers. Thank you for having me.
Let's crunch the numbers now, shall we? What are the figures telling us in terms of a new surge or a reported surge of infections? I mean, are we starting to trend up against new infections?
It may be a little bit too early to tell. What we do know is that we are not out of the woods yet. So with the new level of lockdown, with people moving more freely, we have seen numbers go down before we move to level 1. But at the current time, the numbers seem to have stabilized, but it really is a little bit early to tell whether we're going to be trending upwards. It is all in our hands, as it has been said before, because this is indeed a preventable infection.
Yeah, as you say, it's a bit too early to tell whether we're out of the woods. But then, isn't the improvement in the recovery rate some sort of indication that we are almost out of the woods?
Yes, we actually have to be happy that the recovery rate is as high as it is at about 90%. What we still need to know, though, is of those that are active cases, we need to have more information beyond just the numbers. We're looking at 50,000 active cases, but we don't have, hard information on the clinical information of these people that are infected. A large majority of them are in the community. Because in general, it's a smaller proportion of people that require admission to hospital. So it will be important to know how these people are faring in the community. How are they isolated? How good their adherence to isolation measures is, because that is going to determine, how much they are likely to spread infection to others, particularly to those that might even, acquire a more severe form of disease.
And there's talk of a possible second wave in South Africa, but what are the chances of that happening if it does indeed hit us in South Africa?
It is a common phenomenon that, a second wave occur. The time lapse between, the going down of that first wave and the surging up of the next wave, for us, we haven't, gone through a long enough period to really find ourselves in a space where we can say that we have stabilized enough and we may not hit that second wave. It is a little bit early to tell, but other countries are experiencing it, and some of those have actually gone up to about 80 days between going down and then picking up again. So it really depends on how well we continue to adhere to those practices of, sanitizing our hands and washing hands and wearing masks and keeping our social distance. So all of those factors are going to be particularly more important now. When you go to supermarkets these days, you find that the way that we were doing things at the beginning of lockdown or at the early in the pandemic, things are not as aggressive as they were when we started out. So all of those interventions are going to be even more important right now as the likelihood of hitting another surge is we did go through a time in hospitals where in the past few weeks, we actually were hardly seeing any patients coming in with, severe illness. And now we're beginning to see some. It's still very small numbers. That's why one is very hesitant to say that we are getting into the second surge. But it's very important that we still keep to those, ways we have to call it a new normal, and make sure that we keep the infections at bay.
All right, Professor, God forbid, should the second wave really hit us in South Africa, are we likely to see much stricter, lockdown regulations, which by all means have battered the economy and eroded South Africa's social fabric? How do you think it'll be handled this time around?
Sure. Simpiwe, it's hard to say how it would get handled. I think it would really get determined. This is my own speculations here, that it would really get determined by how bad the numbers get.
Okay.
Because ultimately, I think saving lives will always, you will always have to supersede. Saving anything else, because lives will always be most important. The difficulty that we are going to be experiencing now is that the COVID pandemic has not really just been about the pandemic on the health system. There has also been a disruption of other health services. And with that, we find that people, for instance, that would have been receiving their antiretroviral medications have gone through a time when they have not had good access to that. Even for other diseases like hypertension and diabetes, there hasn't been very good access to services. So if we do hit another wave, it's going to be a very difficult time, because then it's going to hit us at a time when people are also suffering from all of these other diseases that we, at some stage, kind of had a good handle, or at least a reasonably good handle on. But if it hits us now, it's going to just be a collision of a number of diseases and epidemics at the same time, which is going to be a very difficult time to go through.
All right, Professor Bulie Magula, thank you so much for chatting to us this evening. We do appreciate your time.
Thank you. Thank you, Simpiwe.
All right, that was Professor Bulie Magula. She's the head of Department of Internal Medicine at the University of KwaZulu-Natal, joining us via Skype.